So let's start. There are 7 settings. These are called 7 pneumonia syndromes. First is community. Community is schools, offices, workplaces, running around in the bazaars and shopping malls and so on. So these are all community areas. Over there, the pneumonias there or caused by interacting with others are divided into 2 types. One are called typical and the other one are atypical. Typical pneumonias, as we discussed over there, here, these are the mucopurulent or fibrinopurulent diseases with the consolidation of the alveoli and the lungs. Atypical are where the lung interstitium is inflamed, but the alveoli are mostly clear. So here, typical pneumonia is usually caused by Streptococcus pneumoniae or pneumococcus, Haemophilus influenza. Remember this high pi. Haemophilus influenza inflames here and causes the upper respiratory tract infections, can cause pneumonia as well, and then lower is the parainfluenza virus, especially in the children. Then is the Legionella. Of course, people who are gathered around in some community event and there is water coolers or there is air mist on the vegetable racks in the shopping malls and so on. So related to the moist areas and community gatherings, Legionella. Moxicella is another that is very common, and especially in the COPD patients, patients with the chronic obstructive pulmonary disease. It is very common occurrence there. It causes acute exacerbation in the patients with the COPDs. Staph aureus. Another thing in the community acquired is the alcoholics can develop Klebsiella pneumonia more commonly. And the Klebsiella pneumonia, how do you figure that out? Your steps, or the patient when he comes in, he would have currant jelly, red currant jelly like sputum. So very thick jelly like sputum, and the reason for that is that Klebsiella produces a lot of viscid capsular secretions which look like jelly. So red currant jelly is the verbiage, is the words that will be used in your question. Now atypical pneumonias, that is the interstitial pneumonias, are mostly by the viruses, but of course other pathogens, bacteria are also involved. Mycoplasma is involved, chlamydia are involved, Coxiella burnetii or the Q fever pathogen bacteria is involved. On the viruses side, respiratory syncytial virus in children, parainfluenza in children, influenza A and B in adults, especially in the older age, and then adenovirus in the military folks. So the people who are working in the military barracks somehow have prevalence of adenovirus. So atypical, mostly viruses and some bacteria as well. Now let's say the person got admitted in a hospital. Guys, thank you very much for watching this video. Make sure that you like and subscribe, and if possible, share it with your friends as well.